Thank you, everybody, for being on the call. I just wanted to share a note of thanks to folks that have been following the COVID situation so closely and helping us get good fact-based answers out to the public. Really appreciate the service that you're doing to people to have the facts and help us kind of navigate this very serious situation. So with my thanks, I'd like to turn it over to Dr. Josh Clayton for today's case update.
All right. Good morning, everyone. Today we are reporting 49 new cases of COVID-19. We have 13 new hospitalizations that are part of that. No new deaths are reported. We have 63 new individuals who have recovered from COVID-19. We have 214 new negative tests that have been performed. In total, we have 1,685 COVID-19 cases in the state. This does include 87 individuals who have ever been hospitalized. We have 7 individuals who have died, 709 individuals who have recovered, and 10,641 total negative tests have been performed today. For the community impact map, we have no updates or information.
Someone is not silencing their phones. Can you please check your phones right now and please silent or mute your lines, and we will continue with Josh right now.
The leader has muted your line. To unmute your line, press #6.
Includes 5 in Lincoln County, 42 in Minnehaha, 1 in Pennington, 1 in Union. The age range of our new cases, we have 3 individuals in the 0 to 19-year age category, 5 in the 20 to 29-year age category, 8 in the 30 to 39-year age category, 9 in the 40 to 49-year age category, 7 in the 50 to 59-year age category, 4 in the 60 to 69-year age category, 6 in the 70 to 79-year age category, and 7 in the 80-year and older category. For the breakdown of cases by sex, we have 23 males and 26 females. And with that, we'll go ahead and open it up for questions.
Hi, this is Kelda Ferris with the American News.
Go ahead.
Yes. I'm wondering if you have attributed any more of the Brown County cases to either the Demcota Ranch beef plant or molded fiberglass.
So at this time, we are not identifying any additional cases that are associated with any of those specific businesses. But just recall that we don't typically provide reports at the individual business level. What we do is if we have an issue where we have individuals who have been exposed, we do identify work contacts that are notified, and if there are specific exposures to the general public, then we would do a public notice for a specific business.
Gotcha. And I understand that the Department of Health sent up a team either Friday or Saturday to the beef plant. Can you kind of tell me what that team was doing?
So as part of our support for businesses, we have a team that was developed to support when we do have a case in a business, and we did provide technical support to help review protocols that are existing within that facility.
What were those recommendations?
There were no specific recommendations that were provided. It was, again, a technical review of their current practices.
Dr. Clayton, JP News Radio in Mitchell. Could you give us an update on how many new cases from Smithfield, and what's their total count now?
So we have an additional 23 new cases that were identified among Smithfield employees. This brings our total count to 748 cases among Smithfield employees at this time.
Okay, next question, please.
This is Stephen Gross from AP.
Hi, Stephen, go ahead.
So, this is a less of an increase from days last week. Is there a reason behind that? And are you hopeful that the, downward trajectory of the increases will continue?
What I would say is a single day, is just is a single fluctuation. What we would need is several days for us to really, provide any sort of idea of what our overall trajectory is. We know that we are receiving our positive and negative laboratory tests, and we don't have anything that specifically attributes the lower case count today that we're reporting, and we will continue to monitor and update as we have additional cases that are identified.
Next question.
This is Carol with NBC. Just following up on Smithfield, do you have a breakdown on the cases, positive cases among employees and the positive cases among close contacts?
So we have 748 cases among Smithfield employees, and then we have an additional approximately 143 close contacts that are cases to those original employees.
Next question.
Jody Schwan, Suffolk Business.
Hi, Jody, go ahead.
Wondered if you could talk a little bit about the volume of testing. It seemed like there were fewer tests reported over the weekend. How are we looking as far as supplies? And if we have enough supplies to test everyone that our current protocol suggests should be tested, is there any thought to maybe broadening what qualifies someone to receive a test, just so we can get some more volume going?
Jody, this is Kim Elson-Reisden. I think it's not uncommon to see less testing happen or results get reported over weekends, so I think that's something that is just a factor at play. We continue to advocate very strongly, including the governor advocating very strongly that testing supplies continue to be made available. We did get some shipments in this morning that help with our ability to support local testing that's happening across the state. So we are not yet looking at recommendations, that are different for who should get tested. So that still remains folks that have symptoms, and they should be ruling out other diseases before testing for COVID. But we will continue to work on the supply chain to get the testing supplies that we need so that we can accelerate our testing capabilities. But I think we feel like especially in the Sioux Falls area where we know we've needed to test more people, that there's been adequate supply in that community.
Adam St. Paul, Dakota Broadcasting in Aberdeen. I had to step away from the call for a second, so I apologize if this has been asked and answered, but do we have an update at all on the hydroxycodone or hydroxychloroquine, test taking place in South Dakota right now?
So the clinical study is slated to open up yet this week, and so we'll have more information on how individuals who may qualify and who are interested in participating can do that. The second part of the study is to make hydroxychloroquine available to positive patients, and that is already happening and available to people.
Gordon Richter with the Alcester Union. Tonight, Dr. Clayton, with the 748 cases at Smithfield, can you project how many others will result from their contacts? And is that curve in Sioux Falls going to be a lot different in Minnehaha County than the rest of the state?
So what we know is that as a total for the number of all of our cases in the state, that individuals have approximately 10 or even 10 or fewer close contacts that are being identified. The information that around whether those employees, are contributing to the overall peak within Minnehaha County, that definitely is part of their the transition of Minnehaha County's peak to be a little bit earlier than the estimated peak for the state. For the state, we are still estimating a peak of COVID-19 cases that would require a bed to be the second week in June. The overall peak that has been estimated by some of our partners, that includes the Sioux Falls Health Department, as well as Avera and Sanford Health Systems, are showing that the peak for Minnehaha County and Lincoln County would be the middle of May.
This is Mark from the Black Hills Pioneer.
Go ahead, Mark.
Two questions. Have there been any rapid recovered patients who have received the hydrochloroquine at this time in South Dakota? And then secondly, with a substantial number of false negative outcomes on the tests, what is the guidance to physicians and to patients who continue to have COVID symptoms after a negative test?
This is Kim Elson-Rice, and I can answer the first question, which is actually going to direct you to Sanford or other providers in terms of their use of hydroxychloroquine in positive patients for any experiences in it as a therapeutic. They would have more information for you on that.
And I think for the second part of the question, I'm not sure where the focus of false negatives is coming from. The information that we have on the available tests that have been approved by FDA under their emergency use authorization, while there's not a specific sensitivity and specificity associated with those, nor a predictive value positive, predictive value negative, the overall test itself does very good at identifying cases. So I'm not sure exactly where the concern for a bunch of false negatives is coming from, but that's not information that we have seen.
We've had numerous physicians in different health facilities say that there's upwards of 30% of false negatives.
Yeah, and what I can say is that information, is not something that is
supported by the research.
Exactly. There's nothing that is out there that is saying 30%. So while it might be a perception or some information that has been relayed from one source to another, it is not the knowledge of the current testing capability that comes from the scientific side of things.
Thanks, Mark. Next question.
Dr. Clayton, from KOR News Radio, I forgot to ask you earlier, of the 748 cases at Smithfield, how many of those have recovered, if you have that information?
That is not something that I currently have at my fingertips, but if you want to provide that request to our information, our communication staff, and I'll have Emily give you what the email address is to send those requests to. We can get that. Yeah,
JP, can you just email me at COVIDmedia, all one word, COVIDmedia at state.sd.us. I'll follow up with you.
Thank you very much.
You're welcome. And was there another?
Joseph from the Capital Journal, please.
Go ahead, Joseph.
Good morning, y'all. So the CDC has changed their tune, and they say everybody should wear some sort of face covering. Yes, no, do you expect South Dakota, like everybody, do you think it'll take over in Sioux Falls and Minnehaha? Should everybody do it at least when they go to the grocery store? What do you think South Dakota should do?
So I think the information that is provided from CDC is based in ways that individuals can protect themselves. I think that it's focused on that individual precautions that they want to take, and so I think it's focused on whether an individual feels that it's necessary to wear a mask in those situations. I think it also needs to be informed by the information that's out there. So, that is one of the reasons why we have the community impact map that it helps identify, where we are seeing transmission, and so, areas where people are living that are experiencing substantial transmission, it should be a stronger component to their overall precautionary measures that they're taking.
The only other thing I would add is, please help us make sure people understand that masking is not a substitute for proper social distancing, and that folks really need to be careful and try to maintain, at least 6 feet from other folks when they go out.
And that the other piece is that the N95 and surgical masks really should be reserved for medical professionals or under direction of a medical professional, and that the focus is on cloth face coverings if you are wearing one of those as you're out either running errands or out generally in public.
Okay, and we will take one last question if there is one.
Hi, it's Hannah from CBS News. This is Lisa with the Argus News Leader.
Lisa, go ahead.
Okay, just wondering, Good Samaritan had 40 cases over the weekend, and just wondering if there's been any increase in cases since Saturday.
Can you repeat that question, please, Lisa?
Yeah, Good Samaritan here in Sioux Falls had 40 cases between Thursday and Saturday reported, and just wondering if there's been any increase since Saturday in the number of cases connected to Good Samaritan.
So what I would say is that, Good Samaritan is providing us any of the testing, both positive and negative, that they're doing. I don't have any updated numbers from what they may have provided, either publicly or on their website.
Okay, thanks.
Thanks, everyone. We appreciate you being on the call today. Take care.